Welcome to an episode of Conversations That Count, a special podcast series hosted by MAS in celebration of International Women's Day. I'm your host, Anuki Premachandra, and on today's episode, I have Shevanthi from MAS and Manindri and Subhodanie from Hirdaramani. Hi guys, welcome. All right, I'm going to jump straight into the conversation, and Manindri, I'm going to come to you first. Tell us how Hirdaramani prioritizes well-being amongst your staff and associates.
Over the years, well-being has been one of the key aspects. We've actually gone into a more structured approach as per our sustainability pillars. One is directly empowering our associates, the other from a social aspect, the communities. So in terms of well-being, we have a unique program at Hirdaramani's. It's called Wonders of Wellbeing, and it's called WOW. So Subha here actually leads the whole strategy behind well-being. And actually we're celebrating 10 years this year.
Very cool. Shevanthi, I know that well-being is a priority for MAS. What is MAS doing in the area of well-being for employees?
It is really at the heart of what we do. With the launch of the Women Go Beyond program in 2003, a lot of the initiatives that were done in various plants came together in a more structured format. Initially, maybe looking more at physical well-being, but over the years, understanding that there are different aspects to this well-being story has come in. And of course, for all of us, women's health, women's well-being is key. 70-80% of our workforce is women. So while we look at the bigger picture, we really focus on women's health from the time of sexual reproductive health, maturity, all the way to menopause.
Right. Okay, so we've been talking about health and the physical aspects of well-being, but well-being also includes mental health. Let's dive a little bit deeper into that. What is well-being really?
So well-being really is one of the key pillars of employee experience. Right. Sometimes people think it's about physiological and psychological, but it's much more than that. It's about families, it's about relationships. Today, more and more, it's about socials, it's about financial, especially in today's context, that has also become a priority area. It's also about career advancement, career aspirations, and how our employees can be role models to people in society, in the communities. So we use them as peers to take these messages out into schools and into other community youth groups and so on.
It's very interesting. Is it the same for Hirdaramani, Subhodanie? Is that what well-being encompasses for you?
For us, actually, well-being is all about having a life well lived. We are 5 dimensions. For example, physical health and well-being, right, mental well-being, relational well-being, and then economic well-being and the environmental well-being. So whenever we do some initiative, we see what are the relevant pillar or the dimension, and based on that, we actually design the programs or initiatives.
Very interesting. And you guys said you're celebrating 10 years of WOW. What are your key learnings during this journey?
I think over the 10 years, Subha has helped us sort of carve the strategy as we go along. As we celebrate 10 years, our main objective is to take it 100% to all the markets that we operate in.
We believe as a business, if we are not doing the well-being, there will be a lot of consequences. That is why we name this strategy as Wonders of Well-being, because if we do well-being right, we will create wonders in our employee lives. Right. What we did different in 2014, make a strategy around the well-being, right, and so that we can implement it methodically, systematically, and scientifically. Right. So our approach is 100% scientific. Right. And we have measures, we have impact assessment, baseline. We always drive this process. We are a data-driven process.
Right. Very interesting. Shev, if I come to you, tell me what impact or changes have you really seen in a very practical sense with your staff?
Today, I must say, with the new generation coming in, people are way more informed. Wrongly sometimes, maybe. So our part is to ensure that we give them the right information so that they're informed to be able to have that necessary autonomy over their and control over their body. So we also do programs around non-communicable disease prevention. So these are lifestyle and mindset changes that we need to do. Apart from physical, we also do emotional well-being and mental health. We've got counselors in all of our plants. Again, with the country context, we look at financial well-being, how to manage your money better, and things like that. So practical programs that are based really on the needs and priorities. While we have the pillars, while we have the strategy, it is dynamic. It is what people need at this moment that we need to give them.
I think it worked well for us also, the counselor approach, because the newer generation, they're open to a lot of information from social media, etc. And it might not be absolutely the right information. So that having that one-on-one sessions with the counselors have actually helped resolve most of those emotional and social worries they would have.
That's really interesting. And I would come to the two of you, Manindri and Subhodanie, about this one. So I'm understanding that well-being encompasses physical but mental health too. Tell me a little bit about the impact of all of these things.
If you see the data, again, the data, now we have a very huge demand. And earlier it was the psychiatric coming to the facility one day, but now 3 days she's coming. So that has created a big awareness and also taking their responsibility towards their own mental health. And that's the most important part, because now they know how to identify if I have a sort of a mental health disorder. And also if my family member is suffering from some sort of thing, they again come to us for support. For example, children, their spouses, their family members. Yeah. So it's a big network now. Around the mental health.
Especially when we get into mental health, Sri Lanka is quite new to the game of mental health, right? So tell me a little bit, when you introduced these programs to MAS, did you have to do a little bit of cultural sensitivity, or did you have to kind of break the ice?
I think initially, yes, people used to kind of sneak and go and see the counselors many years ago. Yeah, but today it has become more normalized. More people are going to the counselors now, and even we have partnerships with the base hospitals to take it further if that is needed. Last year, MA signed up with the Sumitrio on a partnership, and we've got dedicated health lines that we publish all levels of employees who can then call this. And I also think that as a people, as a culture, we don't like to talk about being sick, especially needing support in a mental area. We might say, yes, I'm having a stomach ache or whatever. But when it comes to this and I need help, that's like an area that we are uncomfortable with. But these kinds of programs really normalize it, especially in rural areas. I think that has been created a lot of good impact.
Before we started the podcast, we were also talking about situational experiences, right? And relationships. And so tell me, I'll first go to Subhodanie and Manindri, you about it. Tell me about that aspect of well-being. Why is that important?
I think family as a unit plays a key role in terms of supporting each other. Whatever the learnings or whatever we sort of engage and drive awareness across our employee base, it's important that they take it home as well. So part of that aspect, we try more and more to, have opportunities created to take this message out to their communities.
So regarding this relational well-being, because human is a social being. So the social part is really an essential part of the overall well-being. So that is why now we are also empowering our employees to have a good relationship. Not only families, their peers, the workplace, their friends, the children, the holistic community, even including social medias. So during this employee session, because we have in Hirdaramani group, we call 90 minutes live coaching sessions, which is very, very unique. There are production units in the apparel sector. So we bring these production units together, maybe 2 to 3 lines together, and give some key message or the educational session around one particular theme. So this way, we are providing the right information. As Shevanthi correctly mentioned, taking the informed decisions is very, very important because eventually well-being is about the choices you make. And to make the right decision, you need right information. These life coaching sessions help employer to give very, very practical tools and also right information, and so that they can apply to themselves, their families, and even they can replicate anywhere.
Chev, so we've been talking about strategy and policy for quite of the conversation already. I want to know the challenges. What keeps you up at night?
So challenge for us is working with 4 different generations of people.
Oh, wow. That should get
With
tough.
the Gen Zs coming in today, how do we keep engaging them better without using this traditional form? And I think sometimes in this space, you can do so much for the year, because sometimes when we look at, our beneficiary numbers or impacts at the end of the year, you're like, wow, did we do so much? But it's still not enough.
Yeah.
For instance, at MS Intimates, we have mapped 350 schools around our localities. We have actually mapped them, talked to principals, and we do programs with them. But there are people beyond this 50-kilometer radius and various, please come and do this for us. So what keeps me really up at night is the fact that I don't have enough resources to be able to really change the world like I want to.
Yeah, but you're on track.
But the good thing is, behind an industry where there's a lot of people, so the impact all of this makes is huge. So that's something I think we can be proud of. So even that little thing you do goes into so many homes.
I think this was something we were discussing. Chev, you said it's very interesting. You were saying how you deal with 4 generations and how you need to adapt to make sure that you keep Gen Z engaged. Well, what are you doing differently now? How are you changing things up?
So all of our facilities have in-house radio. So they may have listened to something even that is 15 minutes long on a radio. Today, they won't do that. So maybe even, things like QR codes, because about 80% of our workforce has smartphones. So really, it's about how do you use the tech platforms better, more effectively. They have access to some information. It's not like the previous generations, especially in rural areas, who may not have had access to that level of information, and they look to us. Today, I think it's our responsibility is to ensure that the information that they have is really accurate. So I think that is one key way that we have now worked with these different generations, and also knowledge sharing. People who have been in the organization, people who are role models, Women Go Beyond. We have our Bimani program, which is recognizing empowered women who then are able to really mentor, coach these younger people who are coming into the organization. Because sometimes, we might think of it in a very strategic way, which is important because that is driving the organization's priorities and strategies, but also what is that real need on ground.
Recently, we had a couple of focus groups just to understand how they are benefited through certain programs we've done. So WOW was one of those. So some of the learnings that they've basically taken, how you manage your kids at home during exams. So and how proudly they were voicing the fact that the kids themselves have come back and said how they saw the mother in a very different way during that exam, and which had helped. So things like that doesn't come to you in your feedback form when you have at the end of a session.
Unfortunately, we've come to the end of our podcast today, but before we wrap up, I want to talk about what the future has in store for both Hirdaramani and MAS in terms of your well-being efforts towards your employees.
So we are in the process of expanding to other stakeholders, maybe the state, private, non-government, because we have already been invited to share our experiences and tools and practices. And other than that, we are in the process of expanding to other countries also. So we are not actually putting the same wow model to the other countries, but they have opportunity to localize and bring in local flavor. But they also have a huge demand because some of our concepts are universal.
That's very interesting. What about you, Shev?
Something that we focus on, will continue to focus on, is women and health, because some theories show that there's such a ripple effect when you give that knowledge. Like Manindri said, the information, they take it home, they share it with their kids, they share it with their aunt. But look more also at general health, and especially men. In our industry, that's an area where we didn't focus so much. So that is now becoming a topic for us. And I think collaboration and partnerships is the way forward, because we can't make the impact we want to make just by ourselves. And like Subha said, it is about sharing, open sourcing some of the work that we do, and collaborating not only within. So I think within apparel, in these areas, we do collaborate, but opening it up to other sectors who might need these learnings. So that is an area that we will also focus on.
It's very promising to also hear both companies place so much priority on well-being, because I feel like that really trickles down to your staff and how they feel and how they go about their day-to-day lives. So thank you for the incredible work that you guys do and for joining me in this conversation.
Thank you.
Thank you. Thank you so much.